Hello, I am Dr. Rajasekkhar Pappuu, diabetic food specialist from Onus Robotic Hospitals. How to avoid complications in diabetic food? How to identify complications in diabetic food? So, before you land in diabetic food complications, there are warning signs that you might develop diabetic food complications like infection or neuropathy or anything. So, you must be very careful. You have to keep an eye on these complications and be careful before you develop complications. What is the first sign? First sign is toe deformities of the foot. You might develop hammer toe or mallet toe deformity in the diabetic foot patients after you develop a neuropathy. So sensation is lost, and then slowly you start developing foot deformities, or also you might also develop hallux valgus deformity, and also you might develop flat foot deformities in these patients. So you might develop metatarsal head drop, which causes leads to the formation of callosities. These callosities are the main starting point for any diabetic foot problem to lead into a complication and a full-blown infection leading to amputation. So how to avoid these callosities? So whenever you have developed deformities, you have to act before they become complication. So yeah, when there is a deformity, you have to approach a doctor, diabetic foot specialist, and take his opinion and how to correct those deformities. So initially these deformities are supple and correctable with braces. So if you correct these deformities with braces, you use braces, so you can avoid this development of callosities. After development of callosities, the biggest mistake what we do is cutting these callosities and making a wound over the foot. This will lead to the spread of infection through this wound and causes full-blown infection. So you have to avoid these, removing these manual removal of these callosities, and also concentrate on only deformity correction. You develop callosities because of deformities in the foot, and callosity is only a secondary problem, not a primary problem. So you have to, instead of addressing the primary problem of the diabetic foot deformities, people start addressing callosities. So that's where you commit a mistake. So this is the first thing where you have to take care of your foot and then avoid complications. Second thing is, in neuropathic foot, you develop senseless foot. So you will not have sensation. So whenever you walk, you have to wear chappal or shoe, even at home, even outside, even in your garden. Otherwise, you will develop small wounds in your foot which you do not know, and you might not even know because there is no pain and sensation in your foot. So that will lead to the accumulation of dust and microbes in the wound and turns into a full-blown diabetic foot infection, leading to the amputation of your toes, and then it might extend up to the below knee amputation also. So diabetic foot amputations is associated with higher comorbidity and death. So you have to avoid compulsorily amputation. So when you know that you have a vascular problem in your diabetic foot, vasculopathy, you have to approach an Elizarov surgeon so that your diabetic foot can be handled very properly to improve your blood circulation, and you get these wounds to get properly addressed and healed without any complications. Thank you.